Thank you, Victor, and thank you for the organizers for giving me the opportunity to contribute to this very important conversation. And let me just share my reflections or my presentation in three ways. One, I will speak very briefly about access to what I characterize as pandemic commodities and the supply chain of that, and with specific focus on diagnostics and vaccines. And then I will also speak to our own, what is required, what lessons have we learned as from where I sit with respect to what we must do to get ourselves better prepared for the future. And lastly, a common reflection on what we can do as a globe to be better prepared for the next pandemic, recognizing that we still have this pandemic in our hands. So let me start with the issue of access and supply chain. When this pandemic hit the continent on the 14th of February 2020, the continent here referring to the continent of Africa, which my comments will largely reflect on that. In January of that year, just last year, there was no laboratory on the continent that had the reagents to test for COVID-19. No laboratory. By February 8th, to be very specific, we had worked with the Pasteur Institute in Senegal and the National Institute of Communicable Diseases in South Africa, in abbreviation NICD, to equip them such that we could bring all countries to either of those facilities and quickly ramp up the capacity and capabilities of testing. Here, I must say that when I say that there was no reagent, I wanted to be very sure that we did not misinterpret that as lack of laboratories. There are so many laboratories on the continent, but given the speed at which the virus was characterized and the sequences were analyzed and the diagnostics detected, I think the continent found itself in a place where it had to rely on external supplies for diagnostics in order to be able to test. And we recognize that, of course, there's absolutely no way that you can fight an infectious disease without doing the testing. So by the end of March, the continent, thanks to the support from the Africa CDC and the World Health Organization, had equipped nearly all with that capacity to test. But the testing was sluggish. So we decided that at that point in April, where the continent had tested just about 300,000 people, and this is a continent of 1.3 billion people, that it was time to launch a partnership to accelerate COVID testing. And we call it a PAC, Partnership to Accelerate COVID Testing. And that was very successful. And today, as a continent, we've now tested close to about 46 million people. And that is remarkable progress, with a test positivity rate of about 10% and a test per case ratio of close to 10, which is where we should be. So I'll start with the diagnostics to highlight the challenges that, as a people, we face by not producing diagnostics locally. And I'm very encouraged to see that at least 5 countries, including Senegal, Morocco, Nigeria, South Africa, and Kenya, are beginning to embark on the ability to test, to develop diagnostics. Let me now segue to vaccines. In June of last year, we recognized, June 23rd and 24th to be very specific, that the continent needed a strategy to access vaccines. And if you recall, at that time, there were no vaccines. But we recognized that the game changer in this pandemic was going to be access to vaccines and timely access to vaccines. So we brought the continent together under the leadership of President Cyril Ramaphosa, who was the chair of the African Union at that time, and developed and adopted a continental strategy for access to vaccines that had 3 pillars. One was for the continent to engage in clinical trials. And remember, we were in June at that time. We just didn't know if we were going to get a COVID vaccine. The second was to say, well, if there's vaccines available, let's have access to vaccines. And also think of manufacturing vaccines locally meaning on the continent. And third was to deliver. that we built on the formula we've established at Africa CDC that says vaccines plus vaccination equals life saved equals economic save. As we speak today, however, despite the fact that we had anticipated that access to vaccines would be problematic, we were still faced with the challenges and are still faced with challenges of supplies of vaccines. As we speak today as a continent, the continent has immunized just less than 1.4% of its population, and our target is to get to 60% of the population of 1.3 billion people immunized by 2022. So at this point and at this pace, we begin to question if we will truly be able to scale up vaccines at speed and at scale to eliminate COVID on the continent. That is my greatest concern and my greatest worry, that if we do not do something different and step back and hit the reset button, my fear and worries is that, and deep fears, I must add, is that we might be edging towards endemicity of this virus on the continent. As we speak, just Seychelles has vaccinated about 60% of its population. COVAX mechanism has completely stalled because of the situation we are seeing unfolding in India. We don't know when a second round of distribution of COVID vaccines will arrive the continent. And this is in a scenario where many countries have already used up their first doses of the AstraZeneca vaccines. I just came back from Rwanda, from a field visit in Rwanda, where within 1 week, they were able to use all 290,000 doses of the first doses of AstraZeneca vaccines, where within 1 week, they were able to use up 50% of all 102,000 doses of the Pfizer vaccines. And they are now waiting for the second doses to be distributed once the time has elapsed appropriately. That alone is not going to give us the herd immunity that we strive to achieve. So at this point, I really call on, it's an appeal that I continue to make to the international community that while looking at ways, looking forward, we should really look at strengthening our supply chain for vaccines so that in countries that have acquired excess doses of vaccines can redistribute so that we put that in the arms of our people. And collectively, we can emerge victorious in a short space of time from this pandemic. As I move towards my conclusion, let me share then my reflection for the future. In order to look at carefully strengthening our global health security architecture, we must do a couple of things. One, as a region, we must embark in continental manufacturing of diagnostics and vaccines. The second thing is that we need to strengthen our workforce and have a competent based public health workforce at a continental level. We currently need 6,000 epidemiologists, just by way of an example, and we only have about 1,800 of them. We need to strengthen our own national public health institutes, the equivalent of each member state having their own mini CDCs, so that you can swing into action immediately when threatened, as we have seen in COVID. And lastly, building the right partnerships with the private sector, appropriate partnerships with our partners, what are called Friends of Africa, is very, very critical. We are calling this a new public health order, that relies on science and the protection of science institutions from political harm so that they can do what they are designed to do, and they use and believe in science. Our trust capital in this pandemic has eroded a lot each time the political dimensions are brought into bear by the scientific community. This is the place to call for the total independence of science and to be sure that we respond to pandemics using science, data, and good programming. Let me just end by again thanking the organizers for giving me the opportunity to share my reflections from where I sit at a continental level in this very important conversation. I thank you all.